evening. I'm Dr. Fred Rouse, the Real Money Doctor, and it's currently just a few minutes before 7 o'clock on Tuesday, the 23rd of June. And I want to touch base on today's daily events that affect the way you get, protect, and enjoy your money, your life, and your retirement. Now, the question for today is, what happens to your retirement chances in the next 10 years? And I'll get to that in just a few minutes. And we start every day, as we normally do, with just touching base on the current number of COVID cases to see what's going on in the world, because that's the main thing that's been affecting everybody pretty much since January, February, or March, depending on what month you decide to get started with things. So right now, the current number of COVID cases in the U.S. is 2,338,000. Okay, that's up about 37,000 cases since yesterday. The deaths right now are 121,029. That's just under 800 people have died since yesterday when we spoke about this time. Now, New York still has a number one spot for most cases at 389,000 cases. They're up just about 600, not quite 600 cases since yesterday. So their number is coming down nicely. Their number of deaths right now is at 31,232. So they've only had 64 people died overnight. I know that sounds crass, but only 64. It means a lot to those 64, obviously, and the people that knew them, their families, and their coworkers. Okay, because you got 64 people who are now in New York State who just aren't there anymore. California's taken the number 2 spot from New Jersey. They did that yesterday. Their numbers right now are 187,000. There were 7.7 thousand cases overnight. 7.7 thousand cases they picked up overnight in a 24-hour period. The only nice thing there is that their deaths are, basically 5,578. Only 53 people died overnight, but 7,000 cases, close to 8,000 cases overnight in California, and that's what's happening. Pretty much the rest of the places. And New Jersey's picked up the number 3 spot. They dropped down from number 2. New Jersey's actually starting their opening big time. In just another week or two, I believe, they'll be opening the casinos again. They did a nice job. They shut everything down. They shut it all down. Okay. And now it's starting to pay off for them. And we'll see what happens. Illinois has a number 4 spot. Texas is the number 5 spot. Things are hopping in Texas right now. California, Florida, all the southern states that were pretty much thought they were immune to things, pretty much just poo-pooed the whole thing. They're picking up cases now. And that was predicted way back when it was predicted that waves would hit in different areas, that the first wave hit in New York area, okay, on the coasts where people were coming in from China and Europe. Okay. And then the waves were projected, the peaks were projected months down the line. Well, it's months down the line right now for these people. And Texas got the number 5 spot. Massachusetts number 6. Florida's at number 7. Okay. Pennsylvania's dropped down to number 8 because 2 other states have picked up some spots in front of them. Michigan's at number 9. And Georgia, again, another southern state, has picked up the number 10 spot. Now, the death rates in most of the states have dropped down from where they were, but the number of cases is going up. And this has got nothing to do with the testing. Okay? It has absolutely nothing to do with the testing. Yes, if you test more, you're going to show more cases. But they were there before. You just didn't know about them. Okay. So if you're pregnant, and you don't take a pregnancy test, does that mean you're not pregnant? I don't think so. It just means you're ignoring it or you just don't know about it. So more testing is better. Okay. And yes, the cases are going up. Some because of testing, because you know about them now. But others, the actual transmission is going up. And that's what's happening all over the place right now. People are still dying. And the rates of infections and the deaths are still going up. Again, in the southern parts right now, the South and in the West, where they thought they were basically untouched. Now, they did rapid reopening. Okay, even the governors now in those states are really reconsidering requiring wearing masks, as their numbers have jumped exponentially. In the last 7 days, their numbers have jumped big time. And now all of a sudden, you see them starting to backpedal a little bit. They're going to do that a little bit more as those numbers increase some more. Now, the chances for a vaccine, ready for widespread use this year are basically slim to none. Doesn't matter what the president claims is going to happen. The doctors are saying that's not going to happen. And even when a vaccine is available, sometime next year, what it seems to be is that the vaccine is not going to be magic. It's not going to make everything go away. There's going to be a year or two improving the vaccine because they don't know how long it's going to last initially. So the vaccine is a good start. But again, don't anticipate the vaccine is going to make it go away like magic. It's not going to happen. So we're stuck here for pretty much a year, maybe 2 years, with the social distancing and the wearing of masks. We'll see how well everybody does with that. Now, there's a quiet part of the news that you may have missed, and that the Trump administration, is really eager to claim that the coronavirus situation is over, and they're considering scaling back the national emergency that they declared earlier in the year because of the pandemic. And that's according to healthcare industry officials who've spoken with the administration. Now, that prospect has really stoked alarm among public health leaders, physicians, hospital officials, and others who are trying to really control the outbreak, and the fear that such a move would make it more difficult for states and local governments and healthcare officials and the systems to actually deal with the coronavirus itself, to keep it in check. Well, several industry officials interviewed by LA Times said that they received indications over the last week from the Trump administration that lifting emergency declarations was actually being considered. And that it was very much under discussion, said one industry official who asked not to be named because they don't want to jeopardize their relationship with the administration. What a surprise. The discussions have really taken place as hospitalizations and caseloads have begun to climb rapidly in certain states that have moved to lift the early restrictions and on businesses. And the administration is really trying to end these emergency declarations. Get back here just for a second here. Now, this is according to Dr. Georges. He says that, I know the administration is trying to pretend this is over, but it's clearly not. And Dr. Georges is longtime head of the American Public Health Association. He said many governors are still struggling to figure out what they need to do, particularly in those states where, they're just beginning to realize that they have emergencies. We need the flexibility that the emergency declarations actually provide. That's what he said. Now, the emergency declarations by themselves, the administration has issued since the beginning of the year, have loosened or waived the rules and regulations on hospitals and other medical providers and helped them, root out badly needed money to the states. They got some extra money to the states that they couldn't get before. Now, they had a dramatic expansion of telehealth. That's been a real big thing. That's helped a lot of folks. And that's been smoothed. The entire implementation of that has been smoothed dramatically because of the emergency declaration, allowing Medicare and commercial health plans to reimburse clinics and hospitals for telephone and internet visits. That normally was not possible before. I'm certain you remember that if you were sick before and you just needed an antibiotic. You had the same thing before, and you call your doctor and they needed you to come in. They need you to come in, not to prescribe the antibiotic, but because they couldn't get reimbursed for it. That's why you had to go in. Now with telehealth, it's making it really great for a lot of folks that they can handle some more routine things. Just by a phone or by the internet. And a number of patients have been able to see their doctors again without going to the office, which is good for everybody, especially with COVID the way it is right now. Similarly, hospitals have been able to quickly hire more staff, sometimes from other states, and add beds without going through the lengthy permitting process that normally takes place. There's lots of things that go on in hospital administrations that regular people would just not understand. tied up with red tape. Okay, to hire somebody from out of state is unheard of. So the emergency declarations have really helped to do that a lot. And they've helped free up additional Medicaid money for states that made it easier to ensure that people who rely on Medicaid won't lose their coverage, during the economic downturn. And a lot of people have been hit with that. Now, California received a waiver from federal government to allow patients on Medicaid, on its Medicaid program, to quickly receive mental health and substance abuse treatment via telehealth. That's a real big deal for a lot of folks. That saves a lot of aggravation for people. Now, many people were unaware of how important these declarations are to the ability of healthcare systems to address the coronavirus. Okay, and some of the hospital association said, yeah, this is really a big deal. Many members are scrambling to keep California's outbreak in check. Okay, California is among more than 24 states where the number of coronavirus cases is now rising, according to data assembled by the Coronavirus Resource Center at Johns Hopkins. And they're still the number one people with carton numbers in. Now, increases in some states largely reflect more testing, which health officials say, they believe is in the case in California. However, many states, including Texas and Florida, are also recording a surge in hospitalizations. That's the serious thing. It's the hospitalizations that they weren't ready for before. You get more testing, you get more cases. More cases, okay, just because of testing doesn't mean you get more hospitalizations. You get more hospitalizations because you actually have more serious cases. Those cases are on the rise in Texas and in Florida. Now, public health experts fear that deaths may soon begin to rise again after months of a long decline. COVID-19 has caused, more than 120,000 deaths right now in Americans. It's projected to go even further. And I remember not that long ago, we were all shocked, absolutely shocked, that more than 50,000 American people had died from COVID. Here we are just a couple months later. Now we're over 120. It's projected to go to at least 150 right now also. So we'll see what happens. Now, despite the worrying numbers, the Trump administration has really been downplaying the threat for weeks, as the cost of the economic slowdown has become increasingly acute. Now, declaring an end to the national emergencies may bolster, the president's claim that the country has really, returned to normal. But you saw what happened with that. That's not happening. One of the declarations of public health emergency issued by the Department of Health and Human Services in January, it renewed in April. It's set to expire late July unless the agency renews it. Now, these additional declarations, one called a National Emergency Declaration and one called a Stafford Act Declaration, are also critical to sustaining the health system. Okay, they need that in order to improve their responses. Key waivers have increased access to many critical supplies and depend on these declarations being enforced. Okay? And that's from Chip Kahn, the head of the American Hospital Association. It's totally unfathomable to me how they would ever drop any of them. Trump was really reluctant to issue a national emergency declaration in March, as he worked at the time to try and downplay the severity of the coronavirus outbreak. That delay prevented states from fully leveraging the Medicaid systems and the programs, really causing state leaders calling for White House action. That's what got things moving. Now, what's going on? That's what's going on the macro level. And that's important stuff. But what does it really mean to you? What does it mean to you on a personal level? And that brings me to the question for today. What happens to your chances for retirement in the next 10 years? Now, after 20 to 40 years of work, the idea of retirement should be a pleasant thought for most people. However, the last 30 to 40 years, the idea of retirement has really terrorized many because they know they're just not financially prepared. It was like that for all of last year, too. Now, the events of 2020 to date have really multiplied the fear and frustration for most people that are 50 and over, that once thought that they just had the normal retirement problems to deal with. Well, with COVID crisis, it's really upended the entire idea of retirement planning and preparedness. Now, a survey conducted by TD Ameritrade between April and May revealed that current coronavirus induced economic downturn really is affecting people's retirement plans, even more than the Great Recession in 2008. And that nearly crippled the country. 2008 wiped out a lot of people. Some people still haven't recovered from that. But Ameritrade did this survey, and what they found is that the Gen Xers, they expect to be the hardest hit. Okay, but what do these impacts look for Americans right now who are still right now preparing for retirement? Gen Xers have a few years yet, but if you're one of the baby boomers, okay, what can you expect? Okay, when your retirement rolls around. Now, if you thought that the last 40 years of tax policy screwed you, you ain't seen nothing yet. Okay, when the pandemic put millions out of work, okay, and forced businesses to shutter, okay, the U.S. government approved a massive COVID-19 stimulus package. Okay, that money added substantially to national debt. That $3 trillion that they've approved in the stimulus added to the previously existing $23 trillion in government debt. Okay, our debt is now surpassing the equivalent of what it was in World War II dollars. Okay, at the time, that resulted in taxes being as high as 94%, lasting for more than a decade. That debt right now is mainly paid by taxes, and no one knows what the future federal tax rate is actually going to be. Now, with this amazing amount of debt, now there's going to be a huge pressure to raise taxes exponentially to cover the growing debt problem. Now, if you're retiring during those tax surge changes, okay, it can be devastating to your retirement lifestyle. Okay. However, that's just on the federal level. The cost of handling the coronavirus on city and state economies also, okay, add to their debt burdens, and will likely require states to increase taxes to deal with significantly, okay, declining tax revenues. That the expected increase in taxation could occur as early as next year, okay, or if the Job Cuts Act sunsets in 2026. Okay, we don't know exactly when, okay, but the states have been strapped. Okay, no businesses, no tax revenue. States have been strapped. You haven't seen them start to cut back services yet, but they're going to start cutting back services, and they're going to raise their tax dollars. How do they raise tax dollars? Sales taxes and property taxes. What a surprise. And whatever additional fees they can find along the way, which is also gas taxes. Okay, now, okay, that's going to have a severe impact if you're looking to retire. Okay, now, you need to save more money to make up for the loss in income due to the increased taxation. Now, if you're 50 plus, you probably have some memory of double-digit inflation. Okay, although it's faded over the last 10 years or so. Now, another challenge that may result from the stimulus money is higher inflation. Now, you haven't seen it for many years, if not decades. Okay, before retirement, if you're concerned with inflation aspect of what the pandemic is actually going to be doing to the economy, every dollar stimulus money adds to the inflation. It means that more dollars are going to be out there for the same goods. So the prices rise and the dollar is worth less. And therefore it takes more dollars in the future to buy the same things. This leads to people to really change their retirement plans to seek better, safer returns to hedge against the COVID-19 impact on their retirement plans. However, surprise, better and safer generally means lower returns, which really compounds the effect of losing purchasing power of every dollar that you actually save. Now, sad as it may be, Social Security currently provides the main source of income for most Americans. Each passing generation sees diminishing chances of getting Social Security benefits during their retirement. Now, the pandemic really isn't helping anything at all. While a 2020 Social Security trustee report shows that, preparedness for the coronavirus indicated the Social Security Trust Fund was going to be depleted by 2035, a study by the Bipartisan Policy Center suggests the effects of slow wage growth, and extended unemployment will add to the strain and actually accelerate that to 2029 from 2035. Now, if the trust fund is unable to make full payments, all recipients will see an automatic reduction in their Social Security checks. That doesn't even take into account the constant push it's been happening for years now to push the retirement age out even further. Now, being able to retire has really been difficult for years. 1/3 of survey participants said that they just won't retire at all. For others, retirement may be much more than a distant dream. Approximately 75% of head of households ages 55 to 65 had almost no chance to fund their retirement needs, okay, before the pandemic. Before the pandemic. Now, over the last few months, people that were near retirees lost their jobs. They've had to dip into their savings or access their 401k or IRA accounts to pay for monthly expenses. On top of that, the market volatility has made retirement planning a really distant reality for many people that were hoping to retire in the next few years. It's been moving this way for years now. And even more people nearing retirement age suddenly find themselves looking at options for generating supplemental income and passive income during their post-retirement years, more than ever now. Some people are thinking about freelancing. What a surprise. Others are curious about selling products on Amazon. Still others want to leverage their hobbies or crafts into a small business and do something online, okay, such as marketing artwork or handcrafted furniture. Okay, this is not something to do in retirement to keep busy. Okay, they're doing this because they need the money. Most of this, okay, is due to the recent economic downturn and the uncertainty. It just rattled savings accounts. It rattled the whole planning situation. Now, TD Ameritrade studies finds that half of Americans, basically 51%, said they're more open to finding a job in retirement to supplement their living expenses. Well, what a surprise. People have been doing that for years now. Okay, they supplement their living expenses because they just don't have the money. More people near retirement or already retired are asking whether they'll be able to use the income from their home's equity to pay for part of their retirement. And that was always a thing. You would downsize and you'd sell your house and you'd cash out basically. And you have another $20,000, $30,000, maybe $40,000, depending on how far you downsize to. And I can understand downsizing the size of the house. You're married, you're raising, with 2 or 3 kids, you get a 4-bedroom house. Kids get married, move out, all of a sudden you don't need 4 bedrooms anymore. And you're looking for a rancher because you can't do the steps anymore. That's what happens as you get 60, 65. You start having those thoughts. And you downsize and you collect some extra money from that and you live on that extra money. But right now, with COVID, causing such instability, it's also in the real estate market. People are worried, okay? And they want to downsize, but they don't want to take the plunge just yet. They don't know what's going to happen, okay? So it's paused the idea of selling their homes to cash out on the equity until 2021 or even later. Now, COVID has made people hold out further because they just don't know what's going to happen in the real estate market either in the next year or two. Okay, is there going to be a glut of homes and all of a sudden they're not going to get the money they thought they were going to get? Things happen. Now, many people are affected financially, okay, on a very personal level. Some of the worst, though, may have been those who actually laid off or otherwise lost a job because of the COVID. Now, the money that they were putting before into their retirement has now stopped. The money that they thought they'd be using in retirement, right now, they may be using that money right now to cover living expenses when their unemployment benefits stop. Now, if you were lucky enough to still be employed in all this, you're already rethinking your long-term financial plans. It's reflected in your retirement savings plans. People are either stopping their contributions altogether until they feel that the economy stabilizes, or until they get a better understanding and feel for the volatility of what's happening in the job situation and the market itself. Some people actually pull their money out of their current retirement accounts in fear that they're going to lose what they have. These people who lived through 2008, they saw what happened to them then. They took a 45% hit. A lot of them didn't recover from that point. So it makes sense. You've been stung once, you don't get stung again. You pull the money out, you throw it in cash. And that's okay, except it doesn't grow. And it was enough to keep you in retirement then. And you pull it out and it's not growing at all, with the current interest rates, you're going to run out of money in no time at all. Now, the COVID situation has also affected a number of businesses, and a decision by some employers to actually suspend matching contributions to retirement funds, which is another blow, okay, to retirement savings efforts. Major employers are actually suspending 401k matching for their employees, effectively lowering the rate of return and potential growth for these accounts. And as a financial planner, always said, oh yeah, max out your 401k contributions because the company's going to match the first 3% of it generally, so you're getting 100% return on your money. That's great. Okay, now people are not doing that at this point in time. And it's a survey by the Plan Sponsors Council of America found that 21.7% of companies that offer 401k plans with 1,000 or more participants were having to suspend or were considering suspending their employer matching contributions, including giants such as Best Buy, Land's End, and Tenet Healthcare. Now, after 20 to 40 years of working, you had an idea of what you wanted for your golden years to look like. However, right now, Americans are really revising their idea of what retirement may look like, with younger generations showing more flexibility. For instance, 45% of millennials are open to having a roommate in retirement, while only 18% of baby boomers feel the same way. And that was according to the TD Ameritrade study. Okay, now, in addition, 46% of millennials and 11% of boomers said they'd be open to retiring abroad, okay, to save on medical costs. Answering a question in a survey, however, and leaving friends and family behind for a move abroad are two totally different things. A lot of people have tried it by just moving to a different state, different part of the country, only to find themselves that they had to move back within a year or two because there's nobody there for them. The support structure that they knew had changed too much, was non-existent once you moved out of state. Now, outside of the actual cash flow, the lifestyle concerns, healthcare is really one of the biggest concerns when you're retired. It's one of the big concerns now if you're 50 plus. You just don't know what's going to happen with it. The virus has affected many people at many ages and health profiles. Almost all of them, everyone suddenly is much, much more concerned about having health coverage for healthcare. Okay, you get treated, and then in 6 to 12 months, the hospital insurance are fighting that back and forth as to who's going to pay the bill. And eventually, when they figure out that neither one of them is going to pay it, guess what happens? You get the bill. Okay, the day of reckoning comes. Okay, and it's going to be another tough financial pill to swallow at that point in time. Those bills are critical, and you can have some insurance, but the cost of the insurance itself is off the wall. And how far do you go? How much deductible do you take? How much of that expense are you going to be eating? Again, medical bankruptcies were going up already before COVID. What do you think they're going to be like in the next coming year? What used to be viewed as something that could only happen to other people has suddenly has the potential to affect even the healthiest of us. Big change. Big change. So what's all that really mean to you? Okay, nobody really wants to work forever because they need the money. Most people want something in their retirement, but they want to do something, but not because they need the money from doing it. Okay, the long-term goal for most people that if you're 50 plus, okay, you want to retire when you're still young enough to actually enjoy it. The real question is how. How do you do it? What type of plan do you have at this point in time? Because, it was shaky before. Your plans were shaky before in 2019. Then COVID hits, upends everything. They're really devastated now. So if you're 50 plus, you have only a very, very short window of time to make any substantial difference in your retirement outcome. Save an extra $500 to $1,000 a month if you could do it. Really, it's going to make a big change at this point in time. It's going to add, another month to you, maybe, of income when you go to retire. Most people retirement, it dries up in 2 to 3 years. Why do you think? You see a 70-year-old stocking shelves at Walmart. Why do you think you see a 65-year-old waitress waiting tables at the diner? Okay. They're doing it because they need the money. Okay. Now, if you're 50 plus, do you really have a concrete plan to get the cash flow you're going to need to reasonably comfortably, somewhere, comfortably, okay, not lush, just comfortable, retire at all? Remember, if you keep doing what you've done, you're going to get the same result you've always been getting. Okay? It's Einstein's definition of insanity. You keep doing the same thing, expecting a different result. If you want something different, you need a new plan. Doing something new. Okay? It's really a no-brainer at this point in your life. Now, you can get a new plan, one that will give you the confidence to know that you don't have to worry about the stock market. It's going to crash 2 to 3 times while you're actually in retirement. It's ugly now. What happens when you're retired? Again, while you're in retirement, you've got 2, possibly 3 times the stock market is going to crash while you're actually retired. Nobody talks about that. Not one financial planner talks about that. I've been in the business for 40 years. Nobody talks about that because they can't sell your product for that. So, what does that mean to you? Can you get a plan that's going to do that? Can you get a plan that's going to be inflation proof? Okay. So that you and your money don't have to worry about it at all. You can get a plan, okay, that you just don't have to try and survive. Okay. You can actually retire in style. Now, you can't be getting a Lamborghini every once a year or something or other, but you can be happy. You can actually have the cash flow that you need, so you don't have to worry about these things. Now, I may be able to help you get that plan. Okay. I can help you get the control back in your life, get the cash flow you'll need to generate, and retire in just 3 to 5 years. Never have to worry about the stock market crashes or working ever again. And you already know that if you're 50 plus, if you've still been working at all, they've been trying to sideline you for a while. With a COVID situation, it's an easy excuse to get rid of you now. What do you do then? Do you want to be applying for Walmart? Probably not. Now, I can't help everybody, but there's a real good chance that if you're listening, I can help you. Go to my site, drrousenow.com. There's a 12-minute video there. It explains the program. If you're interested, schedule a call. Don't put it on a to-do list. Schedule a call. Put it on your calendar. Okay? And we can at least talk. Now, I can't promise anything. The call doesn't cost anything either. And you can't buy anything on the call. The only reason for the call is to see if you actually have a need or not, if I can actually help you or not, and do I think that we can actually work together. So do that. Go to the site, drrousenow.com. Okay. Look at the video. Watch it a couple of times. See if it makes sense to you. It details what the plan is. And then we can chat. I'd like to help you if I can. Again, I'm retired. I can't do everything for everybody. But if you're watching, I can probably help you. Now, I'm Dr. Fred Rouse, the Real Money Doctor. And my only goal is to help you get, protect, and enjoy your money, your life, and your retirement. Now, I appreciate spending time with you. We spent a good bit of time tonight. And I look forward to seeing you again tomorrow, probably around 7 o'clock or so. So thank you.